Carry on, baby. All right, Carry On, Baby by Patrice Roberts there, just giving you some local hot music before we get into this interview, because it's one of those interviews that I'm sure is going to make a difference to your life. So let's welcome to the program at this time Dr. Adesh Sirjusingh, who is Director of Women's Health in the Ministry of Health, to talk to us about pregnant women and their ability to be vaccinated. Good morning to you, Dr. Sirjusingh.
Good morning, Natalie. Good morning to the members of the public listening and viewing.
Thank you so much for joining us. So, Doc, a lot of people, were concerned because we had our first maternal death, from COVID-19 a few weeks ago, and people were concerned about, if I'm pregnant, will I be able to vaccinate? We saw the WHO a few weeks back as well saying, yes, it is safer for women to be vaccinated, and the Pfizer vaccine has been approved for women to be vaccinated. So let's just talk about that. Is it just the Pfizer vaccine, or can they take any vaccine?
Okay, yeah, that's a good question to start with. So basically what we are doing is we are starting off at this time. We have given approval for the Pfizer vaccine. We do not want to complicate matters by we have had a lot more information and research published on what's called the mRNA types of vaccines. There are over 250,000 women enrolled in databases, so we have scientific information to guide us. However, in general, most of the vaccines that are being produced, the technology is something that we know is safe in the past in other vaccination programs that we have done with pregnancy at all trimesters sometimes. What happens when you get this mRNA vaccine, which is the Pfizer type? It lasts in your system a very short space of time. For pregnant women in particular, the vaccine itself stimulates an immune response. The vaccine gets eliminated from the body very quickly, but the vaccine does not cross the placenta to the baby in the pregnant woman, or if you're breastfeeding, it doesn't go in breast milk. So that's very safe based on the technology and what we know of how vaccines work.
Do we have that kind of data or information on the other vaccines? Because as you said, we're talking about these vaccines being safe, but we have the approval for one with women who are pregnant. So do we have that kind of data as yet to say what the other vaccines would look like if, pregnant women are to take them?
Yes, these are good questions, but as you realize, it's still relatively early days yet. We really don't want to complicate matters. What we want to focus on right now is the fact that we do have a vaccine that is WHO approved across the globe, actually being used already in many countries. We have it in Trinidad and Tobago, and we have a very good opportunity to protect our pregnant women and our unborn children with this particular vaccine. So I really want to stay focused about this vaccine and not the others just yet. I don't want to confuse the population, because I suspect that will come in time.
Yeah.
We'll get this data, but let us just stick to the Pfizer-BioNTech vaccine.
Right. But the Pfizer-BioNTech has the mRNA, but what even of the Moderna? Isn't it the same kind of technology that's used with the Moderna vaccine?
Yes, absolutely. That's quite right. However, there are less women enrolled in those databases worldwide to guide us when we make these decisions. And I suspect in time we will have many more choices as more approved. There are over 160 to 200 vaccines in trial phases, etc. We're going to forget all of this after a while, and it's going to get so confusing. Yeah. I really want to get people focused on this one particular issue, the Pfizer-BioNTech, which we are rolling out nationally from the Ministry of Health in order to safeguard another set of the population.
Right, and I'm sure that for those who are pregnant, definitely going to appreciate this, their ability to give themselves that extra layer of protection even as they carry, a child. But let's talk about at what time, at what point during the pregnancy is it safe for them to get vaccinated?
Okay, so we would have had lots of deliberations and looked at lots of scientific data We actually had a significant meeting last week, Tuesday, where the Honorable Minister summoned all of these healthcare providers, public-private sector, heads of departments. We also got internationally buy-in from the WHO representatives for PAHO, the experts, to be in that meeting. So based on the information and all of the research we had, we chose to vaccinate our pregnant women in Trinidad and Tobago to initially roll it out after what's called the first trimester. So we'll start at 13 weeks onwards. In the first phase, I always say first phase because these things are liable to change. People say, you said so and so, and then next week you're saying something else. So let's just say for now, we are choosing that number of weeks to make it very easy, very clear decisions. It's based on the advice from your healthcare provider, meaning that the pregnant woman doesn't turn up to these vaccine sites. What the pregnant woman will do is go to your normal doctor, your midwife in your health center, or even your specialist clinic, and they can simply say, look, you're pregnant. What is your due date? And you qualify for the vaccine because you've crossed after 12 weeks of pregnancy. You now go with this information to the vaccine sites, which is actually the same vaccine sites, for the most part, that are being used in the initial rollout for children, which have been well announced by the Ministry of Education.
Right.
So that's the actual process of getting the vaccine.
So 13 weeks, Doc, the first trimester. What's the thought process, though, behind that to say, okay, is it that want to ensure that the fetus is developed to a certain level before we introduce the idea of a vaccine, even though we're being told that it doesn't necessarily pass on to the child?
Yeah, this is about, of course, safety first, as you're quite rightly saying. We have inbuilt this safety level inside of it, although I want to reassure the public that the World Health Organization and all of the other organizations are actually using the vaccines at all stages of pregnancy for the most part, because the technology behind it is so safe. But we are phasing the rollout, so we are concentrating on the higher risk population, because what happens, although you can get COVID-19 at any stage of pregnancy, we have found in the research you are more at risk after week 20 of pregnancy. So you also build a better immune response closer to after getting the vaccine, because we don't know the long-term antibody response. So maybe if we choose that phase, that we will protect mothers as they're coming up to delivery, the second half of pregnancy, where they're more at risk. So there's some science behind the thought. However, if inadvertently someone gets a vaccine in the first trimester, I want to reassure you, regardless of the vaccine, although we haven't specifically approved it, we haven't seen in any of the studies. These things are researched well in the laboratory. There's no direct effect on the fetus. There are no excess problems in pregnancy. So I just want to reassure you, in case you inadvertently have gotten a vaccine in the first trimester, we can reassure you with that degree of confidence that we don't believe any harm will come to you or your baby.
And Dr. Sirjusingh, I'm happy you said that, because my next question is along those lines, that what if somebody is unaware that she's pregnant and goes and get vaccinated, and not necessarily with Pfizer, but with any of the vaccines that are available? Will this prove a risk to the woman or to the child, to the fetus?
Right. So, as you know, billions of vaccines have been given of all types and all forms, different brands. And the World Health Organization's take on it is that women can go, when eligible, for their vaccine. They don't need to do a pregnancy test. And in fact, some women have discovered after receiving their first dose of vaccine, whichever brand, that they are pregnant. So we actually have advice which we are saying that of course, some of these vaccines are 2-dose vaccines. So in those cases, we wouldn't allow you at this time in Trinidad and Tobago to get your second dose of vaccine. And of course, it would be one of the other brands that aren't specifically approved for pregnancy as yet. So those are some individual situations. And again, reassuring you that even if it's early stages of pregnancy, the vaccine itself does not cross the placenta to the baby. And that's one level of reassurance we have from previous vaccine campaigns. We do this all the time. We actually give seasonal influenza every year to our women, every pregnant woman is offered vaccines for tetanus and other things that can help the baby's response. So it actually boosts the mother's response. You get these antibodies. The antibodies cross the placenta and give the baby some level of protection during pregnancy and whilst you're breastfeeding, because we want you to breastfeed even if you've been vaccinated. It's going to protect your baby, who is essentially defenseless against this COVID-19.
Right. But let me go one step further. Let's say you got that first jab because you weren't aware that you're pregnant. You now find out that you're pregnant. You just said that they wouldn't give the second jab if it's not the Pfizer-BioNTech. But would it be given further down the line during the pregnancy?
Yeah, so that's a good question. We have some information for mixing of some vaccines. So the WHO has approved some mixing, and they may approve some other types as more studies come out. But what we may do is, for example, if you get the AstraZeneca, we know the mixing is allowed. So maybe in the second trimester, we'll allow you to get 1 dose of the Pfizer. But these are very individual cases. It's actually very uncommon. The more common scenario is what I really would like especially our high-risk pregnant women, the overweight women, the older women, the young people, but over 35 for pregnancy, the obese, diabetes, high blood pressure. Get vaccinated if you are actively trying to have a baby. That would be the best scenario. So you go into pregnancy already vaccinated. That's the best case scenario. However, if not, for most women who are not vaccinated, we'll try our best to start the process from 13 weeks onward to give you this protection, because the take-home message in all of this is that we are seeing problems in pregnancy. 315 women so far as of last week had COVID-19 in pregnancy at different stages. Of course, for the most part, most would have been relatively well, but some got critical and ended up in the ICU, and some are in the ICU as we speak. People don't see this. And as you know, we had one maternal death of a patient who died after we had to deliver her and so on. But, you know, these are real stories across. Just yesterday, I was looking at some of the information from the Bahamas. 6 women have died as a result of COVID-19 in pregnancy in Bahamas. Yesterday, another woman died in Jamaica as a result of COVID-19. This is what we're trying to avoid, especially as the Delta variant is on its way.
Yeah. Well, I definitely appreciate the Ministry of Health's efforts to protect the population on a whole, but even so, the pregnant population. And I mean, 300 plus is a large number. So let's hope that we can get those women vaccinated. But in terms of for that woman who is pregnant and gets vaccinated, one of the things I'm trying to figure out is, will there be any plans to test before, giving them the vaccine? Any plans to test to see if they're COVID positive? Because I know that even pregnant women are considered high risk on a whole. And even in the regular population, the thought process from the data and from the science is that you don't want to vaccinate somebody who is COVID positive, that there needs to be a window between, contracting the virus and getting vaccinated. So are there any plans to test the women who you sure are pregnant, test them before vaccinating them?
Yeah, so that's actually a good question for the entire population, and also for the pregnant patients. There's no need to test the population in the current vaccination plans. Of course, for those who were symptomatic and found out they had symptomatic COVID disease, the WHO initially said, let's wait 6 months. They then changed it to 3 months. This is an evolving situation. So at some point in time, there may be no need to wait too long. We just don't have the information to guide us. But we have seen no harm in what we're doing right now in the general population. You may have had COVID and be asymptomatic and you didn't know it, and you got vaccinated. So we are monitoring cases as we go along, and we'll get that data. But there is certainly no need to test the general population or pregnant women at this time.
And when will we see the rollout of these vaccines here in Trinidad and Tobago, and where can the women go to access the vaccines?
Okay. Yeah. So we actually piggybacking on the current sites that have been rolled out in collaboration with the Ministry of Education and the RHAs. So we have announced those sites. These are being used right now for our children in the 12 to under 18 age groups. So what is happening as of tomorrow, all pregnant women who have already visited their practitioners and so on, have the paperwork ready, they can turn up to these sites. They will be fast-tracked when they get to these sites. Now, the sites are actually listed and they're quite long. They're changing as we speak, and it's actually on the websites and so on. So I don't want to go through all of them. But I'm asking our pregnant population, there are a few drive-through sites. I prefer, if you could, in the first phase, not to go to the drive-through sites. Go to the walk-in sites where you can sit in some level of comfort and be observed for your 20 minutes. It's a little safer that way. But that is from tomorrow. It's in Trinidad, I must say, as well. Tobago is doing a separate rollout. We should hear some more information later on this. So in Trinidad, all the sites are well documented. As early as tomorrow, you can turn up to these sites. The sites are open from 8 a.m.
Right, but I remember the ministry saying that, don't just show up. What are the documentation you need to walk with?
Sure.
To verify that you can be vaccinated.
Yeah. So, sorry about that. Yeah. So, the sites that, the information that you actually need is, we actually have a simple letter from your doctor, your midwife in your health center, or even your specialist doctor, your hospital. You can use that letter, and the information we need is, of course, we need to verify you are indeed pregnant. It's hard to tell with some women. We need to make sure that you are past the 12th week has finished. So that information is critical. So we want the right persons to turn up. Plus, our healthcare practitioners have been told all of the frequently asked questions, the fact sheet, etc. They're prepared now to counsel the patients in they're the direct healthcare providers, and they can give this information to the patient. They can walk with their medical records. They wear appropriate clothing so they can receive a vaccine. So when they reach to the sites, they've already gone through the counseling process. There's also, to make it easier, I've created an additional form at the Ministry of Health, my team with the Directorate of Women's Health, and you can download this form. We've given it to all the RHAs, the CEOs. They're printing the forms. So for those who are in the public healthcare system, it will be a little easier, and I've also shared it with the specialists across Trinidad and Tobago. They will give this patient the form to make it even easier. But even if you don't have the form, you just need to get that information, and you can work with your records as well. For those who are under 18, it might be a slightly different process. Approximately 1.5% of our, on an annual basis, are teenagers under 18. So for those, we'll need, of course, the usual guardian's consent and so to get the vaccine as well. So that's another layer as well.
Right.
The process will be relatively straightforward. As I said, you'll be fast-tracked. We don't have you just bypass the line, just tell them you're pregnant. You have all the paperwork. We're making this easy. The sites have been forewarned, and we'll be monitoring them very closely to make sure it's a seamless process.
And I remember that there was some mention of having documentation of a prenatal care. What if that is absent?
That's certainly what we're trying to avoid, because we want to guarantee that these patients have crossed the first trimester in the first phase of the rollout. So we don't want patients to turn up and say they're pregnant. It sounds odd. You should be getting antenatal care, which is critical in the general part outside of COVID. All patients should be, of course, visiting their doctors during pregnancy. Unfortunately, as much as 2 in 5 patients right now in Trinidad and Tobago still wait till 20 weeks and beyond. They wait till the second half of pregnancy for their first visit. That's something I need to ensure patients learn, that please, the first trimester, second trimester is critical. We are missing out on some critical antenatal care, and then complications happen, and of course we are doing catch-up after the 20th week. So that's a good question. Some patients actually, this may be a call for all patients to seek early antenatal care, if I can get this message across to people today.
All right, Dr. Sirjusingh, I want to thank you so much for speaking with us this morning, and looking forward to the rollout to see, what the uptake will look like.
Absolutely. Thank you very much.
You're most welcome. Dr. Adesh Sirjusingh, Director of Women's Health, they're talking to us. So for those of you who are pregnant, Make sure you get documentation. Check in with your OBGYNs, your oncologist, your GPs, get that letter, and then you can head to these vaccination sites that the Ministry of Education have rolled out for the Pfizer vaccine and go and get vaccinated. 13 weeks and above. First trimester. All right, we take a break and we'll be back with you.